Yeah.
Okay, oh great, it's even a videotape. Hi! So when we talk about hip dysplasia, we talk about medical versus surgical management, and I will still talk about medical management because when it comes to surgery, I don't know whether we're going to do both sides or one side. You know, we kind of let the dog make that decision for us. You know, and I'll show you some x-rays from
You start with one side first, though.
We only ever do one hip replacement at a time.
Okay.
And then, you know, we give the dog time, and depending on the dog, and I'll show you two sets of x-rays, which were two total hips that I did this week, that, you know, one of them, it has to have its other hip replaced shortly because both of its hips are luxated. I know it needs it. The other one, I did its first hip 12 months ago, but at its 6-month recheck, you could see the muscle loss on the side that he was better on. I suspect he's going to need both of his done, but we do one, see what he does. Medical management is weight control, so making sure that they are lean. I kind of I'm looking like greyhounds from a weight point of view, because the more weight, the more, you know, the harder it is on their joints.
You want him lighter than he is right now?
He's okay at the moment, yeah. And we definitely don't want him fat for a hip replacement because it actually makes it really challenging for us to put things in place, and, you know, fat's not great. Fat is also inflammatory, or produces the inflammatory media, so the fatter you are, the more inflammation that you have. So, which is why if we've got arthritis, our doctors tell us to lose weight before we, you know, before we go for our hip replacement or our knee replacement. Because
his spine is quite prominent right now, which my other Pyrenees never had. So
I mean, he's a good weight. Like, I wouldn't worry, but for future, you know, we don't want him getting overweight. I talk about exercise modification, so I'm not a person who stops them doing anything. It depends on how they're doing. If they, you know, they can go for long walks if they'll tolerate them, better lower impact activity. You know, he can go for an hour or 2-hour walk as long as he's tolerating it. And the thing is I tell people, don't make him run a marathon today, because tomorrow he'll be sore if he hasn't trained for it. So gradual increases in walking, because of course a lot of people, they go, oh, my dog's got hip dysplasia, I'm going to do nothing with it, which is not true, because muscle mass is really important in helping the hips remain stable. So that walking maintains muscle mass, and there are a lot of people that will put these dogs into physio before they'll do any surgery, because they want them to build up muscle mass, you know, pain meds and physio to build up muscle mass, because it will capture the hips. And I'll show you a set of x-rays that kind of really shows that. And then medications, and there's the medications like Medicam, gabapentin, that are actual pain medications, versus dogs' your nutraceuticals, the omega-3 fatty acids, the glucosamine chondroitin sulfate, which we're already on, the joint supplements. Cartrophin is another one, which we traditionally think of it once they've got arthritis, but it actually helps prevent it. So, you know, I usually recommend they go on that. And those nutraceuticals, all dogs should probably take. We should all probably take them for all of our lives, to be preventative rather than treat once something's happened. The medications, you know, if they're an old dog, you know, that comes to see me at 10 years of age, I'm going to exhaust my pain medications. When I get a dog that's, you know, 12 months or younger, or, you know, early age, I probably tend to say surgery, you know, because you don't want him on pain meds to be able to function for the rest of his life.
Right.
That's not what we want him to do. We want him to be running and playing and doing everything normally. Surgery, so then, so for him, I would say surgery. He obviously is having quite a lot of difficulty on his right side, and he's not able to do the normal things, so a total hip replacement. There are two surgery, you know, the triple pelvic, double pelvic, as I said, I'm not a big fan of. Usually it's a surgery that either doesn't need to be done or doesn't work, in my experience. And for those that doesn't work on, if we've done it, it does make it harder to do a hip replacement in the future. And it increases our risk of infection with a hip replacement, which is one of my most devastating complications, is if I get an infection. We'll go through that. The two surgeries, there is an FHO, which in a large breed dog like this, I would strongly discourage. FHO is where we cut off the head of the femur, take the ball away, and you're relying on the muscles around the hip to hold the hip stable. So in a big dog, less reliable often they have problems with functional outcome, and they often never build muscle back up to what they should do. Okay, they maintain muscle loss and don't do great. The alternative to the FHO, and the FHO's advantage is it's cheaper. You know, it will provide pain meds, but it's cheaper. The alternative to the FHO, of course, is a total hip replacement. So, Alan, in that top cupboard, I have a set of hip implants, which, you know, I don't like having sets